Hello, my name is Zalima Crow. I'm going to be the student nurse practitioner today. I'm going to be doing your HEENT and lung assessment. So we took your vitals earlier. Your blood pressure was 120/80. Temperature was 98, pulse was 76, respiration was 16. Your SpO2 was 100% on room air, and you reported 0 for pain. We have closed all the blinds and doors to ensure your privacy. Do you have any questions, or do you need to use the restroom at this point? Okay, so we did your Snellen chart earlier, and that was reported 20/20 vision. And right now I'm just assessing your overall stature, making sure that you're not in any signs of respiratory distress, such as intercostal breathing, nasal flaring, no cyanosis around the mouth. I'll go ahead and have you just kind of mimic my movement. If you can go ahead and do this with your hand, and then that would be just assessing for clubbing. We'll also do the Fallon test, where you can just hold your hands like this. Typically we would wait a minute to complete the assessment, but we're not gonna hold it for a minute. In addition, you can go ahead and lower your arms. In addition, I'm just assessing for your skin for any abnormal moles. Check your capillary refill, which is a 2. I'm going to go ahead and assess your hair. So I don't see any infestation. It's clean, shiny, equal distribution of hair throughout the face. Let's see what else. I'm going to do some cranial nerve testings. So if you can raise your eyebrows, squint your eyes, smile. You can open your eyes, puff your cheeks. Okay, good. That's just cranial nerve 7. Next, I'm gonna do a sensory test. So just on your face, does this feel the same as this? Mm-hmm. Does this feel the same as this? Mm-hmm. Does this feel the same as this? Mm-hmm. Good, so that's cranial nerve 5, and that's intact. Go ahead and chew. Good. That's good. So TMJ is intact. I'm gonna go ahead and do your lymph nodes. So auricular, post-auricular, occipital, tonsillar, segmental, right here. Let's see. Cervical, posterior cervical. Go ahead and turn your head, and that's deep. Deep here. Go ahead and shrug your shoulders. Supraclavicular. Okay. Go ahead and lower your shoulders. Right now I'm gonna go ahead and let me grab my so I'm just kind of noticing your irises here, just okay, so that contracts. Perfect. Okay, so pupils are equal, round, and reactive to light. So if you can go ahead and look behind me, but focus on my finger. Okay, so pupils accommodate. let's see. I'm just gonna go ahead and continue the eye exam. Sorry. And I'm just gonna look inside your pupil, kind of observe observe your cornea and for any abnormalities. So go ahead and look straight ahead. Okay, yeah, it's gonna be bright, sorry. So I'm able to notice the cornea here, and I don't see any bulging or redness. I'm gonna go ahead and move over to the other side. I'm able to see the optic disc. And no herniation there. Let's see. I'm gonna go ahead and do just for cranial nerve 12. If you can stick your tongue out. All right. That is midline. If you can move it to the left and the right. Good. Go ahead and close your mouth. And if you can press your tongue against your cheek here, against my resistance. Good. And again here. Good. I'm going to go ahead and just observe your mouth. If you can go ahead and open your mouth. Okay, I'm just observing the mucosal membranes, making sure it's moist, no redness, no inflammation, teeth intact. I know, it sounds funny, but it just, gums as well are pink, moist, no inflammation. You can go ahead and say, ah. Okay, that's also cranial nerve 10. I'm just observing the tonsils of it. Can you stick your tongue out and say ah? Okay, tonsils are about a 2. Okay, yes. That is it. I'll go ahead and do your ears now. Oh, you know what? I'm actually gonna do another cranial nerve test. If you can go ahead and follow my finger. Just kind of doing an H pattern here. And that's cranial nerve 3, 4, and 6, which are intact. I'll go ahead and move on to the ears now. Let me know when you can no longer hear my fingers.
I can hear. Oh, you stopped.
When I stop.
Yep.
Okay. Great. Next, I'm gonna do the Weber and Rhine test. Alright, so for Weber here, go ahead and be able to hear that.
Yes.
Okay. I'm gonna go ahead and do the Weber. Okay. Does that sound louder or does this one?
That one.
Okay. This one or this one?
That one.
Okay. And then, okay, so right now I'm also noticing whether your nose is midline or not, assessing for, let me just grab my other light here. Oh, that's fine. I'm gonna observe the interior of the nose, observing for any deviated septum, any excess drainage. None is observed. Mucosa is moist, no inflammation. assess just additionally your ears. Any pain or tenderness there?
No.
Okay, good. I'm gonna go ahead and look at the interior of the ear. And I can see the light reflex there. No excess drainage, no redness or inflammation. Move over to the other side. Okay, and same for the left side as well. Let me see. We did your mouth. Let's see. Oh, one thing I forgot to assess is the uvula. You can go ahead and say ah. Okay, so I'm just assessing and making sure that the uvula goes up and down with ah, and it does. See if there's anything else that we've missed. Okay, so I'm gonna go ahead and move on to the thyroid. So if you can just kind of move that way a little bit, just so I can kind of be behind you, perfect. So I'm gonna go ahead and try to feel for your thyroid here. Okay. And I'm just gonna push one side. Can you go ahead and swallow? Good. And swallow again. I'm also gonna assess an additional cranial nerve that I forgot earlier. Can you go ahead and swallow normally? Perfect, okay. I'm gonna here just start assessing for midline trachea as well. Okay. And then if you can go ahead and move your ear or your shoulders up and down. Go ahead and try to shrug your shoulders, but against my resistance. Good. Okay. Now I'm assessing for structure or strength of the neck. So I'm going to push against you, but move against or push against my resistance. Okay. Yeah, I know. Just push against my resistance. Okay. Okay, let's see. Oh, I'm gonna have you turn your head here. Okay, I'm gonna push slightly. Any pain there?
No.
Okay, turn your head here. Any pain there?
No.
Okay. So next I'm gonna lie you down quickly, and this is gonna elicit any nystagmus or vertigo.
Okay.
Let's see, so I'm gonna just hold your head here. And then I'm gonna have you turn your head this way, and then I'm just gonna lean you back quickly. And I'm just observing your eye movement for nystagmus. Okay, come back up this way, and come back down, and come back up. Okay, so none nystagmus was present. Any vertigo present?
No.
So now I'm gonna go ahead and I'll start this way. I'm sorry. I know, a lot of movement, sorry. All right, so one thing I forgot to do earlier, I'm gonna have you cover one eye. All right, and with your I don't wanna like get in the way. With your peripheral, can you tell me what number I'm holding up?
2.
Look straight ahead. So we're assessing just peripheral vision here.
I think it's a 2.
2. Okay, and that up here.
I can't see it. Yeah, 2.
Okay.
2.
Okay, go ahead and cover the other eye.
I don't see anything now.
Switch eyes.
Oh.
Look straight ahead. Look straight ahead.
Yeah.
Okay, so peripheral vision here.
Sorry, 1. Oh, 1. 1. 2.
Oh, good. Okay. Yep. Let's see. Okay, so one thing that I will mention for peds is the cornea reflex test. So for pediatric patients, what we would do is assess for like cornea or corneal reflex, which will shine light in the eye. If not, there's also the cover-up test, where we would do a similar test and just kind of cover one eye, have them focus on something or an object, and then cover the other eye. Let's see. Now I'm going to go ahead and have you turn that way. I'm going to go ahead and assess your spine. Okay. Any pain or tenderness?
No.
Okay. Spine is midline. While I'm here, I'm going to go ahead and do your respiratory assessment. Go ahead and hug yourself. Cozy. Okay, so I'm just gonna. Okay, go ahead and say 99.
99.
99.
99.
99.
99.
99.
99.
99. Okay. Tactile firmness is present and equal throughout. Let's see. So right now I'm just gonna do some percussion. Okay, so equal sounds throughout. We want it to sound hollow, and it does throughout. So next I'm going to go ahead and do a measurement of your diaphragm. I'm just going to locate that. All right, go ahead and take a deep breath in and hold it. Okay, and release. Okay, so I'm gonna mark this right here. Go ahead and take another deep breath in and exhale. On the exhale, go ahead and hold. Okay. I'm gonna measure that here. It's about 5 centimeters there. I'm going to do the same on the other side. Breathe normally. Okay, go ahead and take a deep breath in and hold on inhale. Okay. Go ahead and take a deep breath in and then hold on exhale. Alright, that is of 5 centimeters as well. Next I'm going to auscultate lung sounds. Let me actually go ahead and have you move look the other way. Turn around, just look the
Oh.
other way.
Complete opposite.
Okay. So every time I move the stethoscope, go ahead and take a deep breath. Okay. Breathe in, out, in, out. Okay, lung sounds are clear. And then while I'm doing this assessment, I'm also observing for any use of accessory muscles, which are not present, which is good. So now I'm going to go ahead and do the same here. Any pain or tenderness here?
No.
Okay, so I'm going to go ahead and do some percussion. Okay. Now go ahead and say 99.
99.
99.
99.
99. Okay. And then I am, again, I'm going to go ahead and, sorry. If you can go ahead and turn around one more time. There's just not a lot of room for me there. Yeah, so go ahead and, okay.
Right here.
Yeah, face me. Actually, this is good, so I can do it here. All right, so go ahead and take a deep breath in. Let me see. Oh, I did forget to mention at the beginning of the video that I went ahead and sanitized my hands prior to the assessment. Let me see. Trying to see if there's anything else that we may have forgotten. And then we did, can you go ahead and, I'm just checking for range of motions of your neck. Go ahead and look up, down, midline, left, right, and then that along with the shoulder movements that we did earlier, that assessed for cranial nerve 11. Let's see, before we move on to musculoskeletal, I just want to make sure there's nothing else I'm missing here. Okay, so what we can do is go ahead and move on to the musculoskeletal. We just did neuro.